welcome you all to ISW Council's special web series on women's health. I am Kamal Narayan, CEO of Integrated Health and Wellbeing Council, and you are watching our exclusive show on fertility care during COVID-19. Infertility over recent years has emerged as one of the most common issues that many young couples are facing. According to Indian Society of Assisted Reproduction, infertility currently affects about 10 to 14% of Indian population. The scenario is worse in our cities where 1 out of every 6 couple is impacted. As for every other aspect of life, the COVID-19 has also affected the access and continuity of fertility care for the couples, adding to their physical, mental, and social distress. The month of June is observed as World Infertility Awareness Month, and therefore our today's show is special as we are going to discuss every aspect related to infertility and how impacted women and couples can address this best during this time of pandemic. And to guide you for that and answer your queries on this, we have today with us among India's most seasoned and reputed infertility expert, Dr. Sonia Malik, founder and chairman of South End Fertility and IVF Center in New Delhi. Dr. Malik has conducted over 10,000 IVF cycles and has been practicing for over 28 years now. She has been successfully bringing joy of parenthood for several couples from India and abroad. Dr. Malik has served as president of Indian Fertility Society. She has also served as the past president of Indian Menopause Society. So welcome Dr. Malik to this show on fertility care during COVID-19 pandemic. However, before I begin our conversation today, I would request our online viewers to keep sending their questions on the comment box, and we will try to answer most of them in the next 45 minutes. Also, like and comment with your feedback, and do share this special show on your wall if you find your friends too may get benefited from it. So let's begin today's discussion, Dr. Malik. I welcome you again on this show.
Thank you, Mr. Kamal. Thank you so much for having me here. And I would really, first of all, begin by thanking you and your organization, the IHC, for having me here today with you and giving me this opportunity to talk to so many of your viewers on this special occasion and on this special subject, which is very dear to my heart in this show. You have rightly said, you have very rightly said that infertility is a big problem in India. And although it is a paradox because we are a populous country, overpopulated, and we are all the time considering how we should be reducing our birth rate and how we should make the country better as far as population is concerned. But at the same time, infertility serves as a social cause, or as something which is very dear, or in the society. It marks the well-being of the couple when they get married, and in the society it also means acceptance of the couple once they have a child. So therefore, for social reasons and for cultural reasons, fertility is considered to be very, very important. Reproduction is a part of any culture, and mostly so, very importantly, for India as well. So with that, let me say thank you again and tell you a little bit about what I've been doing. And basically, my organization called South End Fertility is a group of people. And let me tell you all that we are fiercely honest. That is our USP. We are honest, we are very ethical, and we are very transparent. And more than anything else, we all of us, work together, we believe in trying our best to give the couple their own genetic child. So in my units, I don't believe so much in third party reproduction. So therefore, our endeavor is to struggle with the couple, try our best to give them their own child, and I consider that my USP. So with that, let me say once again, thank you very much for having me, and let me ask you now to take this show on.
Thank you so much, ma'am. And this is very important aspect which you touched upon. Definitely, couples who are not able to conceive, despite planning to conceive and planning their family, it causes tremendous social and mental trauma on them. It is whether it because of the social causes, social concerns, or it's a very inherent or inner desire of any living creature to reproduce.
Reproduce,
That
yes.
is also one of the important aspect which is associated when it comes to getting the joy of parenthood. And I think everyone has the right to get it. And with the people like you working on in this area, those who are somehow not able medically to enjoy their parenthood, with the technologies, with the expertise, with the medical care which organizations like your bring, definitely is helping lakhs and thousands of people. Let me ask a very basic question so that our audience can get benefited today. What is this infertility among human, and what causes this infertility?
So it is interesting to see how it has emerged. And initially, when I was a student, it was called sterility. This woman is sterile, and the term was sterility, and that had a very negative connotation. If you call somebody sterile ya banj, as we say in Hindi, it's basically a very negative kind of a feeling that the woman would, or the couple, or the man would get. So therefore, eventually it has now changed over to infertility rather than sterility, because that is a relative condition. It's not an absolute condition where this person just cannot have it. And here we are talking of something which is relative. And it means essentially that if a couple has been very actively trying for a pregnancy for the last year, say about 12 months, and is still unable to conceive, then the condition is called infertility. That is what is infertility. But that does not mean that this couple cannot have a child. We must understand the term subfertility. There is something called subfertility as well. And here I would again refer to our old scriptures. हम लोग हमेशा कहते थे कि दोनों के गुण मिलने चाहिए, हम पत्रियां देखते थे. So it is something like that. Well, these two people came together, they were married, but somehow they were not supposed to produce because उनका शायद गुण नहीं मिलते. But individually they are both fertile, they both can have children, but maybe that combination is not working and it needs help. So that is subfertility. You need to help them and they will conceive, because as such they are not able to conceive on their own, but yes, they are fertile, they can have children. So that is the majority of patients whom we are treating. They have some factor in them which makes them subfertile or infertile, and when we give them the adequate treatment, they conceive. So, and hence, I look at it as a very, very objective definition, and I also look at it as a very objective condition, because this is something that we can treat. So why worry? So therefore, coming now to the causes. So we all know that there are female causes and there are male causes. The concept of having male causes for infertility is again rather new. It's not so old. So about 25 years, 25 years is when we started talking about the male factor infertility as well, in addition to the female factor. So let me address the female factors because they are most important and they form a bulk of what we are talking about today. So most importantly are, people like, let me talk first about the factors where we can treat them very easily. Something called lifestyle factors, where a girl is not very particular about what she's been like. She's obese and she's smoking and she's an alcoholic. So these are factors. And well, she's very much hooked to the cell phone and she's all the time, her sleep pattern is not correct. That is the typical urban girl. So these factors, this kind of a lifestyle is something that can be corrected easily, and an infertile girl can easily be made fertile. And that is all that She can do herself. She doesn't need me for that. She just has to correct her lifestyle and she's okay. In addition to that, there are certain conditions where they can have a problem, like the hormonal problems, like polycystic ovarian disease, which is popularly known as PCOS, which I think every third girl now in the city seems to be having because of the obesity. Then, of course, we have a major bulk of girls who are suffering from endometriosis. This is a disease where there is a collection of blood spots on the ovaries and in the outside the uterus, and which leads to problems with her. A major factor is pelvic inflammation, and for that, it's not just the village population is also very much affected by pelvic inflammation. Pelvic inflammatory disease and tuberculosis forms the major bulk of that. Blocked tubes, because of that, is one of the major factors of having infertility in the rural population as well as the urban population. And then I forgot to mention the pesticides and insecticides, and the fertilizers which are being used. These are actually leading to a lot of hormonal problems in the rural population, but also also in the urban, because we are eating the same vegetables and fruit that are being supplied from there. So, having said that, these are broadly the causes in the female. Again, coming to the male factor, till I said 25 years ago, we were not talking about it, but in 30% of these patients, it is the male factor. And unfortunately, we are finding an increasing incidence of male factor infertility in the cities, especially in the urban areas where we have a lot of IT population. We conducted a study in our own center. We looked at our own semen counts from 2000 to 2010, over a span of about 10 years. And what we interestingly found was that the urban population coming to us from Gurgaon had a bad sperm as compared to the Delhiites, where we were having a mixed kind of a population where, vis-a-vis the population of IT professionals from Gurgaon. That was one thing that came up. The second thing was that we found that the sperm factor improved a bit in Delhi when the CNG came, when the toxins decreased. And then it again shot up because then again the pollution went up. So these are factors which have actually caused a lot of problem to the men over the years. So we are finding an increase, but then as you find problems, you also find solutions for them, Kamal. And hence I say that with the advances over the last 20 years, we are actually enjoying trying to treat these problems because we know we have a solution and we can treat them. And so it's actually very, very gratifying to be able to say to most of my patients that, yes, you do have a problem, but I can find a solution for you.
Thank you so much, doctors. You actually touched upon very important issues. Yesterday was a World Environment Day, and we had
Yes, yes.
a very important session about the quality of air which we are seeing during COVID-19, the quality of air which we have been as a Delhiites or people living in North India have been consistently facing, and they and the studies says that we as a Delhiite exposed to more PM 2.5 and the
Right.
particulate
Yeah,
pollution are
yeah,
actually have more likelihood of having greater fertility
absolutely,
due to COVID-19 because
absolutely.
already compromised lung health. And
Yeah,
you are also mentioning the same thing is also causing infertility.
yes, yes,
So, this is very, the question here in front of us is that the kind of life all of us, whether in cities or villages, are living today, which is not selected always by us. You're not completely making your environment. There are so many contributions to it. Uh, and this is leading to not only a lot of health problems, but also something so natural and critical also. For example, like your own reproductive health. What do you see that if let's say people who are watching today and they want to have some tips and takeaways from your talk, and when you are seeing that so many things are impacting their reproductive health, what is your suggestion that how they can try to prevent it?
yeah. Absolutely. I mean, it's something for which I personally could do a lot of correction, but I can't, because it's not something that I can do alone, or anybody, you also for that matter. But interestingly, and very something that positive has happened is that we as Delhiites, and all the urban cities, have realized over a couple of years that yes, these pollutants are actually affecting us. Plastics, for instance, there has been a lot of movement against plastics and all. And let me remind you about environment, that when we started talking about cleaning cities, and when we started talking about not spreading garbage anywhere, we started a long time ago, say about 10-15 years ago, in the schools. And hence we find that the new generation, the one that is now the younger generation, you are more conscious of throwing garbage on the streets than us, my generation. Because you people have always, we were not taught all this in school, but you were. And hence what I can see now is that the coming generation is also going to be more aware of not using plastics and not doing, if we are starting all this in school. So a radical change of this in the society needs to be made. But in addition to just health, reproductive health must be also emphasized in that. When we are trying to teach all this in maybe to the population and at large, and schools in particular, we have to actually talk about all this, and try to make it uh, as distinct as possible for all of them. So basically, that would be what I can do. And as a infertility, as a reproductive health specialist, what I can do is, that's what we exactly do. We do chart out the things in a listed form to our patients and tell them, look, you have to avoid all this in order to have a better health, a better reproductive health. For instance, food. Don't use anything that is kept in the fridge, because that itself has its own disadvantages. Dioxins you have to avoid. Endometriosis is caused by all that. So basically, all that about reproductive health, we are already telling them. But what you have said about the environment pollution is something that will have to be taken up by governments, by societies at a larger scale. That is not something that only the reproductive people can do.
So you mentioned that there are a lot of factors which are correctable, especially the lifestyle one. And you are saying when the patients come to you, you first try to guide them that where all they can treat themselves or manage it themselves. In terms of these possibilities of people correcting their lifestyle and taking care of what they eat, what they consume, how they live, smoking or alcohol. What is your estimation, doctor, that if these things are taken care of, especially those who are at their reproductive age and want to have babies, if they correct these lifestyle issues, how much is the chances of them having parenthood without
Better, yes, yes.
uh, treatments?
Let's take a specific example of a polycystic ovary patient. Let's take a specific. She's obese, and on top of that, if she smokes and drinks, she's had it. Okay. So if a patient like that comes to me, I do not ask her. It's a psychological problem as well, because they are having cravings for carbohydrate diets and fat. That is their problem. So basically, we as reproductive counselors do counsel them to change their diet and to change their lifestyle. I always tell them that you don't have to go by the height weight charts that are provided. You have to go by your own body. It tells you this is the correct weight for you. If your body weight corrects itself and you start getting normal periods, because one of the common problems with PCO is that she has irregular periods or she has no periods at all. So if by losing 5 kilos you are able to have normal periods every month, then this is your ideal weight. If that weight is 50 kg, you should maintain yourself at 50 kg. If that weight is 60 kg, you have to maintain yourself at 60 kg, because your body clock is telling you you are fine at that particular weight. It's not the height weight. So that kind of syncs with them, and then they try to achieve that goal, because they come to us with the prime concern of having a baby, and to tell them, okay, you have to reduce to 45 kg, they're not ever going to do that. But if they start getting period on after losing 2 kilos, they are happy, because then they know that they have achieved something. So that is how I generally guide my patients. And of course, leaving alcohol and smoking is something that we really scare them about and tell them that this is going to cause problems to the unborn baby, and to the kind of child that you're going to have. The child is going to have something called the alcohol syndrome, and maybe something to do with the smoking also, small for dates baby, and a long term effect on the health of the individual that is born. So for that, yes, we do give them that kind of a negative feedback, so that they are scared and they stop smoking. And majority of the time they do. And about 30% of the patients out of this whole lot of PCO, as it is about 10 to 20% in the country. But out of those, another 30% would definitely would listen to us and come back the way they are. Some people even do it all through their life. Believe me, if you counsel them, they do very well.
This is very important message,
Yes,
doctor, which you
yes,
are giving, and I'm sure that our audience today is also have noted that up to 30% of the people who are not
absolutely.
able to conceive themselves, by just correcting their lifestyle issues and maybe managing something like PCOS properly, can conceive naturally, and they don't need uh, much of the assisted
Yes,
reproduction
yes,
technologies. Uh, and this is, I think, maybe just I can correlate. We have seen and we have heard that a lot of people have conceived naturally during these lockdowns. And
yes, yes.
so what is your thought on that, doctor?
One is, of course, the biggest thing is stress. See, the stress of work, it has been of going through a treatment, is also something which is very important, and some stress is not measurable, but stress is there. So therefore, what happens is, when they start treatment with us, they are so stressed that what is the outcome. They are stressed about the outcome, because we cannot promise them 100% pregnancy rate. We cannot promise them an outcome which is out of this world. So therefore they are stressed about the outcome. And hence, now what happens is, when in this lockdown condition, when they know that they are not going to be able to get any kind of treatment, they forget about chalo chodo. So then that chalo chodo actually affects the psyche, and hence there are spontaneous conceptions. It's not that something magical has happened to them. No, it's their own correction that has taken place, and that has given rise to this. On the other hand, there are other patients as well, because we are receiving calls from both kinds of patients. And the other kind of patients are those who are overstressed because of this COVID, because they were going through treatment, they were actually having problems. Somebody's got, say, they've got blocked tubes, or male factor is acute, severe, and they know they can't conceive. So that group is actually going through a lot of stress at the moment, because of the uncertainty of the situation, because of the uncertainty of the disease, and because of the uncertainty of the time frame. When are they going to get back to us? When is it safe to have treatment now with us? So that group is actually going through. In fact, I would like to inform the viewers that we are conducting a study at our center, and they are very welcome to join that, and take help from us, that we are actually conducting a survey to see how many are affected by this stress of COVID, and how many are not affected. So that kind of thing we are doing, and I would love to have all of you participate in that. But having said that, yes, like you said, the pregnancy rate is spontaneous pregnancy rate is there. Yes, I don't deny that.
That's the good side of COVID-19, I believe. Like we see the clean air,
One
greener
of the nature's correction.
birds chirping. So this may be another positive aspect of it.
Absolutely.
Doctor, we are getting one
Absolutely.
question from a patient in Mumbai, and she's saying that she's 34-year-old, and her husband is 33-year-old. They, his sperm mortality is around 70%, and they are married for 2 years, and they have had she has had PCOS for since 2016, so almost 4 years
Oh, yes.
now. And she also had a IUI failed in December 2019. And she's asking that, can she conceive naturally? So,
Yeah. Again, what PCOs have to understand, that there is a variety of PCO. Again, this is a syndrome which actually there are so many types. To label a person is just PCO is not enough. You have subtypes. So we need to understand what kind of a PCO she is. If she's an obese, she needs to lose weight, like I said. If she's an anovulatory PCO where she's not producing an egg, she needs help to produce an egg. And that must have been done in order to have the IUI done. They must have corrected that. And yet she did not conceive. But then one IUI failure doesn't mean anything in any patient who's had some kind of a treatment. I would suggest that she should again go to her doctor, get herself reassessed over there. Maybe, with a little bit of added treatment or a change in treatment, she will be helped. I don't see anything. And also, the other thing I would warn all of you is that it also depends on where the sperm has been processed and done and actually examined, because sperm reports, the analysis reports, are very variable. In normal labs, you find that the sperm count is absolutely fantastic, good motility, everything is absolutely fantastic. And when they come to an IVF lab, we find that it is actually the sperm factor which is responsible, because we are judging the sperm from the fertility aspect, whereas in a normal lab, they are just doing a routine examination. So that kind of disconnect is also there. So she has to talk about this to a consultant and then see what can be done about it. But definitely she can be helped.
There is another linked question to it, doctor, that how successful is IUI for unexplained infertility?
Unexplained infertility is the group that is going to conceive in COVID, Mr. Kamal, because here we don't know the reason. Everything is absolutely normal and yet they aren't. It has a 5% extra success rate after an IUI. If a person is truly unexplained, and if you say that the natural conception rate of any human being is about 25 to 30%, then after an IUI, an unexplained infertility would be 35%. And interestingly, the IVF also would be only 40%, not 100%, just another 2-3% extra from an IUI, because you really don't know the cause. But then it is important to unexplain unexplained infertility has to be explained. So it depends on where the person has been told she has unexplained infertility. If a GP has told her, she has to go to a gynecologist. If a gynecologist has told her, she has to go to a fertility specialist. And there you will find that the unexplained becomes explained. We find a cause, and then it becomes much better. The success rate becomes much better. That is the difference. But otherwise, like you're saying, just about 5%.
So there was one more question, doctor, where the patient want to understand the causes of unexplained infertility. So I think your answer has already addressed that.
Yes. There are many. And IVF, I would like to tell this person that if you are going to a fertility specialist and they are saying that you're still unexplained, we've done the tests and you're still unexplained, then IVF also sometimes explains the unexplained. Because if you're running an IVF cycle for this unexplained infertility, is the reason she's not conceiving, or the there's a fertilization failure, just that is the reason it is not happening. So sometimes this is actually not just a therapy, it is also diagnostic. So for such people, so the causes could be there rather than in the couple themselves. It could be while you're doing this process.
Doctor, we talked about the lifestyle aspect. What is the relevance of age in fertility for both men and women? What is the age factor?
A very, very good question, Mr. Kamal, and very pertinent to our patients these days, to the society at large. Age is the factor for fertility. And I again go back to saying that when we were having our girls getting married at 16 in the olden times, that was probably because they knew that the fertility declines after very, very quickly in the Indian women. That probably is the reason, because now we have very good studies from India which are saying that our fertility, our reproductive lifespan is less than the lifespan of the Europeans or the Westerns. We age 5 years before them. So if a person is about 35, she's already into that age group where she's going to have a reproductive decline. Whereas a woman of the West would decline at 40. We are declining at 35. If a woman is having a lesser reserve at 32 uh, in India, that is going to be much more bad as compared to the same age in a woman of the West. So a 32-year-old girl in India is going to behave worse as compared to a 32-year-old woman in the West. That is why age is the most important factor in the success of any kind of form of reproduction. Hence, we keep on telling all our girls, all our patients to come to us early, because we can then assure better success, better outcomes in patients who are coming to us for even simple things like IUI or just consultation. But age, yes. And for the man also, now the recent studies are showing that the sperm quality deteriorates after 40, and earlier we used to call it 70. That at 70 years, when andropause happens, that is the time when men start performing badly. But no, now we find that even younger men have deteriorated sperms, and then therefore not only is infertility becoming larger, also the type of children, that means malformed fetuses, malformed babies, are also more in such men. So to both the couples, young age is very important, very important.
Is there a, because there is a question from our audience that what is the peak fertility age for women? So is that
25. 25.
25?
And we
Okay.
don't get any 25 years anymore. Very few.
I think it's not even a age for marriage in
Marriage, yes.
urban settings.
Yes, yes.
So, doctor, so when we are talking about age, and age is the factor you are saying, but there are many people who cannot plan their pregnancy during this bracket.
People.
Maybe many reasons, maybe because as you say that there are people who are career conscious, and they want to build their career and they don't have time for that. And there may be some other medical problems also, especially for people suffering from cancer, or we are seeing that a lot of young women are now developing conditions like breast cancer. So what is the possibility for them, how they can
Absolutely.
plan their fertility or family?
So something very nice has happened to the assisted reproductive technology. That is that we were able to freeze everything. We are able to freeze the eggs, we are able to freeze the sperms, and we are able to freeze the embryos. And that is what has led to a very big program called fertility preservation. So for patients like this, for women or men who are not planning a pregnancy, or they cannot have a child now, we have this beautiful option of fertility preservation. So there are two aspects to it. You also mentioned that there are cancer patients who have a very good survival now, and we have patients who are not able to have a baby yet. So for the first part, we have cancer fertility preservation, and for the second part, we have something called social fertility preservation. So both these are, we are very happy. Like I said in the beginning, I'm one of those who wants the couple to have their own genetic child. So I'm so happy that this program is there and we can help. We are helping actually. Women are coming, but through your program, I would like to tell people that fertility preservation also should be done at a relevant time. I don't talk about the cancer group because they are forced to do it at whatever age they are coming to us. But the girls who want to preserve their fertility because they are not yet able to get married, or they don't want to get married and have children. So for them, it is important that they should come around 30s. Generally, what is happening is that women are coming to us when they are around 40, 38, 39, and they want us to preserve their eggs. But where are the eggs? The quality is bad and the quantity is very little. So we ask them to go through multiple cycles with us in order to have that amount. You also should understand, as I talk to you, that at age 40, you need 16 eggs in order to have one normal child. And at age 35, which for us Indians would be equivalent to 40 of the West. I already said there's a gap of 5 years. So at age 35, you need a good 12, 14 eggs to have one normal child. Where are we going to get that from? So that is why my message to all of you is, who are wanting to do this and who should be doing this, is to come to us early. so that we can have good quality eggs and number of eggs.
The fertility preservation is something which is, I think, everyone should be knowing about.
Yes,
And,
yes.
and
We
this is
should be
another way of
informing. Yes.
preventing any such infertility issues which you may face in future. Maybe it is a right move and a decision
Absolutely. Absolutely. Yes.
to look for this fertility preservation, so that at a time when they want to have child, it can help you.
And the other thing is that I would also like to tell everyone that, even during this COVID time, we have not stopped doing fertility preservation, especially for the cancer group, because that is an emergency. We have not stopped it. We have done it. So that at least, so therefore consider these options, because these are good options and everybody should be aware of them, like you said.
Doctor, I heard there are some occupational hazards also. Certain people, the kind of job, the kind of work they are involved in may lead to a faster deterioration of their fertility or the health of their eggs or sperms. Who are this, who are these people, and what kind of these works are where the people involved in that should be more careful about fertility preservation?
The COVID has really taught us a lot. So we are all talking of occupational hazards, and let me just say that being a doctor too is an occupational hazard in today's time, because we are the warriors. So I'm joking, but what I'm trying to say is that there are occupational hazards. Yes, very rightly said. And let me talk about the occupational hazard of one particular segment which we don't touch very often: the army, the services. These people are out in various outlandish places where nothing is available, and they come just once, and they are many times they are war ridden. Even they have shells which are and guns which have been fired at them. So we do get these patients with very bad semen quality, very bad oocyte quality in their wives, not because they have had that occupational hazard, but because they have been separated from their husband for a long time and they have had no exposure at all. So that is one. But for the men, the occupational hazards are much more. One, of course, in the factory workers, where there is a lot of heat generated. The testis is a cool organ where it is supposed to be kept at a temperature of 25 degrees. And when there is a heated environment around you, then it is actually going to cause problems with the sperm. Similarly, the cell phone and the laptop, again, the laptop, the heat and the electromagnetic waves that are generated by this, these are also occupational hazards, which are the newfound occupational hazards. But then we discussed about the environment in the first part only, and I said that presently everything is hazardous for us because the environment is vitiated in all aspects. So we have to consider that all the time.
Doctor, there's another question, and since we talked about a certain aspect of lifestyle also, uh, and what is the role of food in fertility preservation or enhancement?
Yeah, again, a very good question, but again, a little vague at the moment also, because basically we as doctors or as modern science are not very good, very well versed with nutrition. I would admit that. But having said that, we need to understand that we have to, the basic thing is fresh fruit, fresh vegetables, nothing which has been stored and frozen. Even the frozen foods and canned food, no canned food whenever you are trying to have a child, because and you have to have it seasonally. You can't have bhindi in winter and cauliflower in summer. That is not right. You have to add what is fresh and in that season. And also the all these preserved foods should not be taken. That is one. And the second thing is that the vitamins in your and minerals in your body must be proper, because basically the development of the child, the development of the egg and the development of the sperm is much before the child is even conceived. It takes 90 days for a sperm to form and about 70 days for the egg to form. So that period also has to be taken into account when we are talking about fertility. And you have to therefore start thinking about having good nutrition healthy food, normal food, not extravagant and this kind of fast food that we have been so used to. So I think COVID has done us a good service, because now there is no fast food available for these people. So therefore, good home cooked food, fresh food is something that I would say. The calcium level, your iron level, your vitamin D level, and your B complex level should be absolutely normal in order to have a normal, healthy child. So these things will improve the fertility.
There's
That
another
matters.
another question, doctor, and related again IUI. A patient with a minor PCOS with 7 AMH with good HSA. And sorry, I don't know the full form of all these words, because so
Will
you
tell. Yes.
definitely
Yes.
tell them, and failed to IUI.
Yeah.
So we opt for IVF.
Hmm. Okay. So let me first explain these two terms that she has used: AMH and HSA. HSA is husband semen analysis. Husband semen. What did she say? Is that normal?
Yes, good.
So that is good. So husband male factor is out. It is basically PCO. She says she's a mild PCO, but she's not. Her AMH, that is anti-Mullerian hormone, this is a hormone which actually is responsible for the growth of the eggs in the ovary. And if you have a low AMH, it means that you are producing less eggs. So, but if you have a high AMH, it means that you are producing more than normal eggs. The cutoff is 4.7, and here her AMH is 7, which means that she is producing more. Therefore, the quality again is not probably proper. And hence, she will have to have a correction. See, her hormonal correction is important before she even embark upon the IVF cycle. So, she's had 3 failed IUIs. She
Two.
still needs 2 failed IUIs. So, she still needs a hormonal correction before she hasn't mentioned her weight. So, if she needs to correct that, she needs to correct her AMH, and she needs to correct the other hormones like FSH, LH, estradiol. These are the hormones. So I would suggest she goes to a good fertility specialist, and then after getting all this corrected before 2 or 3 months before the IVF cycle, then only she should go for an IVF, not before that, because otherwise even that is going to fail.
So I think that if the patient is based in Delhi or in surrounding areas, you should definitely contact
Yes, thank you very much for that. Thank you very much
the
for that.
Content
We'll be very
Fertility field.
happy to have her and help her. We will be very happy. Yeah.
Certainly. Uh, Doctor, you mentioned about pelvic inflammation, and so there is a question about it, that can you still get pregnant if somebody has pelvic inflammatory disease?
Definitely, you can. That is what I was saying, that these are conditions where we are there to help you. It also depends upon the extent of pelvic inflammation that you have. If you have something which is very, very bad, and the moment I touch you, you will go into severe infection again, then it becomes a little difficult to treat you immediately. You have to go on long term therapy, antibiotics, anti inflammatories, etc., etc. And then we do an IVF cycle for you. But if you have had a pelvic inflammation in the past, and your tubes are bad, then even IVF can be done immediately and with success. Definitely, the success rate after pelvic inflammation is as good as the success rate in any other patient, provided you are able to treat that pelvic inflammation properly. There are patients where it is such a severe pelvic inflammation that the uterus is very badly damaged, and the patient cannot, this is called Asherman syndrome, and where the patient just cannot retain a baby. So in such cases, yes, we suggest third party, but otherwise it is definitely doable. Definitely doable.
Doctor, you mentioned about there is a natural age bracket for good fertility health, but at the same time we see that through IVF and ART, people or women at very advanced stage getting the blessings of motherhood. This one of this question is coming from an audience, that what is the right age of IUI or IVF also? Is there a right age for that also, or it can?
Let me tell everyone that we also have this thing about patients coming to us and being very hesitant about getting an IVF done, because it is a difficult process according to people, and then secondly there is some kind of a taboo against it. But the success rate of IUI is only 12.5% vis-a-vis the success rate of IVF, which is now reaching about 40 to 45% in good centers. So, I mean, so therefore you yourself can assess what should be done in your case. So if a patient is, say, of age 35 or 38, does she have time to do an IUI? Does she have time to keep on trying and with a success rate of just 12.5%? And should she not be taking the best treatment? So therefore, the study, there are now, we shouldn't be talking so much about China, but yes, I'm forced to do it. But there is a very large Chinese study of about 16,000 patients there, that was a retrospective analysis, where they have suggested that anybody beyond age 35 should be directly put through an IVF. They should not be going through an IUI, because there is so much of difference in the success rate between an IUI and an IVF. But then on the other hand, we do have patients coming to us who have just got married at age 36 or age 38, and they have never even tried. They've never had an exposure. So then how can you just tell them to go through an IVF directly? They will never accept it. It's not anybody. Even if I was told, I wouldn't. So definitely, yes, you can try an IUI if your husband is absolutely fit and fine. There's no problem, but not like this, keep on trying again one after the other and not get any success. You should move on faster. You should move on faster. That is the message as far as age is concerned. Age tells you that you have very little time and you should move on. That's what it is.
I believe you addressed this question very well. Doctor, one thing, those who are actually going through these ART procedures or may need, and especially after your talk today, also those who may decide to go for a consultation or for IUI or IVF, what they are going to expect from clinic like yours during these COVID-19? What is the new scenario going to be?
We are the same. We haven't changed. Neither has our treatment style. We are going to treat them the way we did earlier. Only thing is that yes, because of the COVID, there are many more restrictions on how we can talk to them and how we can interact with them. So now most of the consultations that are taking place with me are through this medium as I'm talking to you. So we tell the patient, we send them a declaration forms asking them that they do not have any exposure to the disease, and that they haven't traveled, and all those things have been put in there. Then we take a consent for them, asking them and telling them that if they are exposed to certain things, we will be forced to cancel their treatment in between, even when we have started it. So with all that, and in fact, I would like to tell you all that as societies of fertility societies of India, we have got together, and the IFS has just now released the guidelines for us for fertility practices to start practicing, and I was one of the members of that task force. Therefore, I'm telling you that we have got very stringent measures. And once the patient is coming to us, also before that, we talk to them like this on the phone, take their entire history, they send their case files to us. We go through the case files, and then based on their case files, we decide what kind of a treatment or management is required for them. And once all that is decided on teleconsult, then we call them into the clinic. And in the clinic, again, all precautions are taken in order that nobody catches infection. So we have to protect both the patient and our staff from not getting the infection. So all those precautions are taken.
And
So
what has changed for those who were already in between of their cycles? Has this been delayed? Or you are going to advise them that they can wait for some time? What is continuing and what has stopped?
in between, we have been stressed because of the lockdown situation. We have patients who had to come to us from Gurgaon, and suddenly on the day of procedure, we got to know, oh God, this one is not able to come to us because now there is a lockdown. So those little bit of glitches have happened, but we have addressed everything, and believe me that we have been able to successfully complete our procedures for each one of our patients who had started with us. And to patients who are hesitant to restart again, I can only say that yes, I know that we all are scared. You are scared, and I am scared. But the reports that are coming from all the experiences abroad, that means China and Italy primarily, and now also from the US, none of them is saying that it is unsafe to do an IVF cycle or an IUI cycle. We have to always take care of the precaution. If suppose somebody is COVID positive, in that case, yes, we cannot do the cycle. we have to cancel it because we are not sure how much of the disease is going to be transmitted. No such report is available at the moment from any country. But yes, in the COVID environment, if you're not a COVID patient, then it is very safe to start any kind of treatment. There is no risk at all. That is what is the guideline today.
Thank you so much, Dr. Malik. It was wonderful talking to you, and you actually given some of the really very, very useful guidance and insights about the reproductive health, about fertility, what to, people should worry about and where they can make their own corrections as well. And as a society, as a humanity also, we need to also look into many of the other factors which we are creating by our own maybe negligence or maybe greed, which is causing more damage to the environment, to the food supply chain, or many other issues. Thank you so much for your time, and we would like to wrap up this session for today. So here was Dr. Sonia Malik from South End Fertility and IVF Center answering your questions on infertility and its management and cure. On this Infertility Awareness Month, let us all assure couples who have difficulty in attaining parenthood that they need not to be disappointed, as doctors like Dr. Malik are there to assist them with advanced and proven medical technologies and compassionate care. If you have more questions, you can send them to us through WhatsApp. You can click on our WhatsApp button on our Facebook page. Also, don't forget to follow and stay updated on our Facebook page, which is coming up with a lot of health and well-being shows. And we are going to have several discussions with doctors like Sonia Malik and many other experts who are going to help you stay healthy. You can also get quick answers on women's health on Ask Tanu Facebook page through the instant chat. This program was supported by Bayer Zydus Pharma under its public awareness initiative Bayer for Women. We will be back with our another special show soon on women's health. So keep sending your questions and we will certainly include them in our next show also. Till then, stay at home, eat healthy, sleep well, and keep giving your mind and soul the daily dose of positive thinking. And don't forget.
Say one parting word to all the viewers, if you don't mind.
Yes, please, ma'am. Yeah.
So I would also reiterate what what Kamal has said to you just now. But all I would like to say to you in this fertility month, is that as people who are having a problem, please open up. Don't keep it to yourself. Share it with you. Share it not only with your family, but also your friends and people like us on these groups, or maybe others chats as well, where you will find a lot of help. You have to create your own support groups. You have to find help for yourself. So just as you talk about other problems, please talk about this problem. Don't think it is a taboo. Don't think it is something to shy away from. Be brave, be honest, and like he said, stay safe and stay healthy. God bless you. Thank you for being here with us.
Thank you so much, ma'am. You concluded it well. So look forward to have another session next time. Thank you all.
Thank you. Thank you, Bayer. Thank you, Bayer.